Good afternoon, and thank you for joining today's press conference. We will begin in usual fashion with a prayer. Dear Lord, we bring this country before you and thankful for the opportunity for life and to be here. Dear Lord, we also bring with gratitude your faithful servants who yesterday so ably held our National Day of Prayer and Fasting. Dear Lord, I actually bring before you our Premier, members of his cabinet, and those who sit in Executive Council. I ask for your continued wisdom and guidance. I ask for safety and protection for our technical staff, medical team, members of the Royal Anguilla Police Force, and surveillance team as they sit on the front line trying to protect us every day. And for the people of Angola, dear Lord, I ask for your spirit of endurance. I ask you to help us to be patient, kind, and understanding in this period as we go through this time, dear Lord. I ask you to bring us out safely. In your name I pray. Amen. On April 22nd, in response to the discovery of a cluster, the government of Angola restricted movements and entered a period of national pause until yesterday, May 6th. During that period, 64 cases were identified, 1,490 persons were tested. In that same period, 1,217 new first doses were administered and 2,390 second doses were administered. Today marks the first day of our four-phase exit strategy from this cluster outbreak. This comprehensive strategy will offer guidance ranging from updates to the list of essential businesses to when we will resume gatherings and when the border will reopen. We are aware that our nation is at a critical juncture. Now more than ever, the decisions that we make individually will affect us all collectively. We are not immune to hardships that are being experienced all over the world. And as such, the most important thing that we can do at this time is come together but stay apart. We have all heard from the Premier, ministers and members of government, the health team, and permanent secretaries and department heads speak on our position in this fight against COVID-19. And from this, we know that it is not clear-cut or a simple situation. It involves the setting of protocols and, most importantly, the following of protocols. I will now hand over to the Premier, who will explain our four-step cluster exit strategy uh, and protocols. Thank you.
Uh, Thank you very much, Honorable Parliamentary Secretary. Uh, Good afternoon, Anguillians and residents of Anguilla. It was extremely heartening yesterday, and I was moved by the prayers and outpouring of the Spirit during yesterday's National Day of Prayer. I wish to thank God for His goodness and mercy and His long suffering. I wish to thank all those who participated and all those who prayed silently. And I know that heaven has heard our prayers and the prayers of others on our behalf. I want to thank all who have been patient and followed the protocols that stayed at home, wore masks, social distance, practice good hygiene techniques. It is this that has got us to this point, but what will get us where we need to go to protect our health, to protect the community, to protect Anguilla is vaccination. And I want to thank all those who have been vaccinated to this point and those who are registered to get vaccinated, and even those who are still wrestling with the idea of becoming vaccinated. As a medical doctor, I have seen patients suffer. And I have seen patients with cancer from smoking and drinking, which has been their choice. Some when it has been too late to help them. And many have said they wish that someone had taken the cigarettes or alcohol away from them so that they would not have put themselves and their family in that position of pain and misery that they encountered. Not everyone gets cancer from smoking or drinking, so some choose to roll the dice and think that it will not affect them until it does. And then when it does, then they wish that someone had taken that choice away from them so they wouldn't have ended up where they are or were. I have seen children suffer from illness, innocent children who had no choice in the matter. I have seen patients who develop cancer from secondhand smoke, from being around smokers. They didn't have a choice. Today we are confronted with a virus which is killing people. And we have a chance to decrease the effects of this virus, decrease the chance of needing to be hospitalized, decrease the chance of infecting others if we take the vaccine. Chance of saving ourselves from getting sick, from suffering, even from dying. Chance of protecting innocent children who cannot take the vaccine. Chance of protecting those around us who cannot take the vaccine or those with diseases which make them vulnerable to, if they get infected, that they have severe critical disease and possibly dying. Yet some choose not to get vaccinated. So today I'm saying, why am I encouraging people to get vaccinated? And the simple statement there is because I do not want people to get sick or suffer or die. Now, I do not want you to regret not getting vaccinated. I do not want children to get infected and suffer when they could not choose not to be vaccinated, because at this point in time, children don't have a choice. They can't choose to be vaccinated because it has not been studied enough as yet. And I do not want those who could not be vaccinated to get sick or die because you choose not to protect yourself or those who couldn't get vaccinated. And so it is okay to be angry with me. It is okay to not vote for me. But vaccinate for yourself, for your children, the students under your care, your loved ones, your community, even the visitors that come to our shores. Vaccinate for them. And so that's why today I'm asking and encouraging everyone to get vaccinated. As a doctor, I have friends, close friends, who have died from COVID-19 disease. I have family who have died from COVID-19. I have persons, I have friends, family who have suffered because of COVID-19, who are alive, but basically know that they have persistent symptoms, and they have effects of the disease that they will have to live for as long as they can live with, as long as they live, and their lives will have been shortened by that. And so that's why I ask, and that's why I insist that people get vaccinated. So we are not here to impose on people just because we have the ability to do it and the Public Health Act allows it under the Constitution. That's not the reason why. We do it because we want to see people not get sick, not get infected, not die. If we had a death in Anguilla, it would affect all of us because all of us are related or interrelated. And so that's why the protocols were put in place when there was a cluster identified. You know, I felt sorry for the health team because we had gotten this close, or they had gotten this close. And, you know, I would go down to the Ministry of Health on the second floor and you see the team, you know, just swabbing persons just to see if they could, you know, identify persons who were positive so they can get them isolated to prevent their being spread in the community. And the dedication they had, sometimes frustrated, exhausted, but doing it with such skill and quiet composure, that amazed me. You know, permanent secretary in health, who is basically since January of 2020 has committed himself to trying to prevent this disease from coming into Anguilla, but if it came, that it was in a controlled manner. That cluster was one that threw us off kilter because it wasn't controlled entry into Anguilla. The CMO, who has dedicated herself, who hasn't had vacation in almost 2 years now. Just think about that. I mean, this is not easy, and so persons can say what they want to say, but the goal here is to save this country from this deadly disease. And so persons complain about having to stay at home. That is the easy part. Think about those who are in the intensive care unit now in places, not yet in Anguilla, but we have 3 cases who are hospitalized. 3 out of 64. Just put those numbers together. We have 8 ventilators and 10 beds. So you got 10 beds, you had 3 with 64 persons infected. Suppose we had 200 people infected. We would have wiped out basically our isolation beds, and then we'd have to close the hospital down to anybody coming in other than with COVID. Think about that. So staying at home is the easy part. And the other thing, social distancing, wearing the mask, these are all inconvenient things, but necessary to curb this disease. And so we had 2 weeks of a pause. And because of the disease process and the contact tracing, where over 1,400 persons were traced, and some needed to be quarantined along with those who are in isolation or positive, it is required that we need to extend that pause. It's the science of it. It's not because we want to do it just because we can. It's the science of it that there are persons that we didn't get to test because they didn't come forward, or they may have been asymptomatic, that we assume that there are some positives that we didn't pick up. That's why you continue to stay at home, so you get through the incubation period, so the chance of spreading it is less. That is why. So that has to be extended, and so that's why there's some new regulations. There is some relaxation, and the relaxation, it may seem, and it is, that those who have been vaccinated and are fully vaccinated, that is, they are 3 weeks or more after their second dose, and there would be some restrictions are lifted. That is also the science, because they have a decreased chance of getting infected, a decreased chance of, if they did get infected, of transmitting the disease, and they have a very good chance of not having a severe disease or requiring hospitalization. And so we have those regulations have been published, and basically we have gone to still want people to stay at home definitely between the hours of 6 p.m. and 6 a.m. Persons should be off the streets. The essential businesses will be open 6 a.m. to 4 p.m. as previously, and we've expanded the list of essential businesses. The 90 minutes of outdoor exercise now has been extended to where you don't just have to stay on your own property, and you can be at the beach, but make sure social distancing, make sure that you wear masks when you can't be social distance when you're exercising. Certainly we require that mask wearing will continue at least until the end of June, and that will be determined again by the epidemiologic situation and by the science, and that is why that is done. So I don't want to go and read all of this because it's out there and people can read, but certainly if there's specific questions can be asked after. Parliamentary Secretary, I'll turn it back to you to, go through the agenda. Thank you.
Thank you, Premier, for your presentation, your very sincere presentation. And I would hope that it impacts the people of Angola who are still considering and gives them a bit more context as to why we are where we are. And this is not scheduled in our format, but I will ask the permanent Secretary for Health just to weigh in because there is a bit of thought that this vaccine and pushing of it is any different to anything that was done before. I know that you can't go to school if you don't have certain vaccines right here in Angola right now. You can't have certain positions. You can't access certain rights right here in Angola right now without having certain vaccines. So if you can just talk about that for a minute or two, because I do want to share with the people that this is not a novel route that we're taking regarding vaccines.
Thank you very much, Parliamentary Secretary. As I sat here and I listened to the Premier, I couldn't but help saying to myself, that is someone who's speaking from deep down, that is someone who's speaking from experience, and that is someone who's speaking from a clear conscience, and certainly clear concern for the people in the country that he leads. Now, I have been working with the Premier now since last year, June, since election. And I must say, listening to him just now, I was taken aback by the sincerity, because I know there's been a lot going on in the country and we've been getting a lot of stick. People have been saying things against us personally. People have been saying things against us professionally. People have really, and I must say it is not the majority, because I think by and large Angola is a law-abiding country. I think by and large, from La Habra to West End, from Shore Bay to the Forest, we have persons living in Angola who really and truly are patriots and really are truly looking for a better Angola and looking for us to get through this. But there are some people who really have taken this degree of objection to a different level. I think from a Ministry of Health standpoint, we have been working now with the people of Angola, with the international community since December of 2019, when we first figured out something was going on. The team in the ministry is a very small team. It's just 4 of us. It is just myself as permanent secretary, the chief medical officer, the health planner, and certainly the director of chronic diseases. The 4 of us who really manage and run the different programs, whether it is quarantine, whether it is surveillance, whether it's vaccination, whether it's testing and compliance, no matter what it is, whether it's policy development, it's just the 4 of us. So I think for the last year, it has been a pleasure to work on behalf of the people of Angola, for the people of Angola, and bring to bear our skills that we never really hope we'll ever bring to bear. These are things we train for when we go to university. These are things we work with scenarios on if and when these were to happen. But these are things we never ever hope happen, and COVID is one of those things that we never thought would happen. So I think the level of sincerity that the Premier has brought to the discourse just now, you can see it from his heart, and we appreciate that sincerity and Premier, because I think it puts everything into perspective. What I would like to say, there are many people in Angola who cannot get the vaccine. There are some people who cannot get it for medical reasons, and there are some people who cannot get it for reasons that the testing just hasn't been done, in particular children. And the Premier spoke to this. The vaccination of adults in Angola at this point in time, and about over 18, is not only a health measure, it is a child safeguarding measure. And I mentioned this in a meeting we just had with permanent secretaries. Child safeguarding is more than protecting children from abuse from adults. It is more than protecting children from the ravages of life. Child safeguarding is also protecting children who cannot make decisions on their own, protecting children who are subject to aspects of life in terms of adults bringing things home, in terms of adults bringing stuff to the classroom, in terms of adults bringing stuff to the playground. We have to protect children against these things. And child safeguarding encapsulates all of this. Why do I mention this? It is very difficult for a child to it's very difficult for a child not to accept certain things that adults and parents offer. Minors are by nature subject to the care of adults. It is for us adults to ensure that we protect those children in accordance with law and in accordance with practice. Many of us adults work in 3 and 4 different jobs in Angola to ensure they make things meet. Some of us work in the bubble, some of us work in the tourism industry, some of us have more than one job to take care of these children. We then bring stuff back home to these children, whether it's in the classroom or whether it's at home. It is our duty as adults to ensure that we do as much as we can to protect our children from this virus, to protect our children and give them a chance to become adults and then themselves can make positive decisions. When children in Angola as young as 7 months old are being impacted by this virus, when children in Angola are in primary school age are being impacted by this virus, when children in Angola at high school age are impacted by this virus, the evidence is there that is not the older persons who will get positive from this virus. So it means then that as persons in Angola, it means that as adults, it means that as responsible persons, we have to put ourselves in a position where we protect the next generation of Angola to ensure that they can live productive lives. In Angola, we do have laws in place that ensure that our young persons, once they attend public school, they have to be vaccinated. It is not new. This is something we've been doing for many, many decades. What also holds true is the fact that up to this date, children cannot be vaccinated against COVID-19. But at that point in time, when that science shows that they can be vaccinated against COVID-19, the government of Angola will ensure that children who attend public school must also be vaccinated against COVID-19. That's already in the plan of our exit strategy here in Angola. Why? Because the government of Angola has a duty of care. The government of Angola has a duty of care to ensure that our children live and learn in an environment that protects them. And this also happens for adults. There are many countries in the world where you cannot even travel until you get certain vaccinations. You won't be allowed on the plane. You won't be allowed to enter that country until you get certain vaccinations. So what we're doing in Angola is trying to ensure that there is a policy development in Angola, legislation in Angola, regulation that ensure that we protect our people. At the end of the day, the Ministry of Health has guided and advised the country for the last year, and I think we ought to understand at this point in time that we will not advise the country in a way that harms their health. It is not something that we do. It's against our mandate. It's against our responsibility. It's against our moral responsibility as the health agency in Angola. So, Parliamentary Secretary, I thank the Premier for his impassioned plea. I thank the Premier for his words of sincerity. I thank the Premier for the actual outpouring of care, because that's what it is. It is care for the people and the children of Angola that we try to ensure that we get beyond this pandemic. Thank you, Parliamentary Secretary.
Thank you, PS Health, for your sincere outpour as well. And I hope that it is well received by the people of Angola to see that everyone involved, we are doing our best, and you all in particular who have been here from January or December of 2019, working overtime. I became friends with the CMO, and I really just want for her to have a vacation and have some time off. And I'm about to hand over to her as we do our COVID health updates in terms of where we are, and if you can touch just briefly on the protocols as well, CMO. Sorry, CMO, you're on mute.
As of today, 2:15 p.m., we have identified 65 persons locally related to this cluster. Of note, our last new positive cases were detected last Thursday. However, since then, yesterday, we detected another positive from a household contact of a confirmed case that was initially negative. The quarantine testing, the post-quarantine testing was weakly positive, consistent with a resolved infection, but it stands to reason that that person would have been infected during the course of the quarantine period. It could be a combination of the person being in the incubation phase or inadequate isolation precautions, as we said, we know is a risk with persons that remain in households, and we had indicated that this is one of the reasons that we had to go so aggressively as well, or inability to control those conditions under these circumstances. So just to note that that person will be listed as a confirmed but recovered already. And then our point of reference in terms of looking at the extent and the evolution of the cluster, particularly in reference to relaxation of the measures, will still be, at the time of writing, Thursday 29th, because that's when the last true new cases were detected for this cluster. That is after having screened more than 1,500 persons, 1,534 persons since the 21st of April. Today, we can record like 17 recoveries from the cluster, 6 from yesterday and 13 from today. We have begun aggressive testing post-quarantine, post-isolation of the cases and their contacts, and we have screened 245 contacts associated with 25 cases between yesterday and today. We've received results for at least 160 of these, thus far negative. Just to note that on a high note, the 3 gentlemen that were admitted, we noted last time that they were improving. One was discharged yesterday, one should be discharged by the end of today, and one is anticipated to be discharged within the next couple of days. I said that this update is current to 2:15 because at that time we finally got the sequencing information from Trinidad, University of the West Indies. It turns out we are dealing with a variant of interest, not a variant of concern. So it's not the variant first discovered in the UK, it's not the variant first detected in South Africa, it's not the variant first detected in Brazil, and not the variant associated with the outbreak in India. So it's a variant of interest, B1526.1, and it was the variant first detected in the United States. Now, just to briefly explain, the variants of concern are the ones that we're looking at in terms of more transmissibility, bigger outbreaks, the ability to cause more severe disease and death, and questions about whether vaccines will be effective or not. So to be clear, we are not dealing with any of those variants of concern. So this variant inherently will be responsive to the vaccines that we are giving. With regards to the vaccinations, we continue to see an increased uptake and demand. We have 8,189 persons registered on the portal. And of those, 7,527 have received at least a first dose. That's around almost 60% of our target of 12,600 persons. And of those, 3,433, 27% of target, have received second doses. With regards to the breakdown, we saw improvements across all age groups. What we are seeing lag, and the main concern right now is in terms of the frontline workers. We made a lot of gains with the healthcare workers, border protection and so on, but we're still lagging behind when it comes to the hospitality workers. We're just about at 50% of those. Let me get that number. Of course, there's a little lag in terms of the data because it's real time, and there's going to be almost real time, and there's going to be a delay in terms of when they update it. But looking at the hospitality workers, we're under 42% of target in terms of registered, who was registered to receive the vaccine. So I will pause it there in case there are any questions.
In usual fashion, we'll take questions at the end of the presentation. We have one more presentation to go.
Okay.
Yeah, I will just hand over to the Commissioner of Police, Mr. David Lynch. But before I do so, I know that it's covered usually, and we can assume that there are persons on the live who are here every day, but we can also assume that there are 1 or 2 persons who may tune in for the first time. And I would just like you to briefly explain, when it comes to a vaccine, the difference between a vaccinated person, their ability to transmit, catch, recover, and such from the vaccine.
So there are several outcomes in terms of what we want vaccines to do. The first and foremost, especially with a deadly disease like COVID-19, of course, is to prevent severe illness and death. So all the vaccines check that box across the board from the get-go. What we needed time and more data to see is whether these vaccines were also able to reduce transmission. And that becomes very, very important in terms of protecting a population and the question of herd immunity. So what we have learned is that with the first dose of AstraZeneca, for example, there are 76% decrease in transmission. And with the second dose, 2 to 3 weeks later, you go up to more than 85% reduction in transmission. Recent data also show that with household contacts, and this is extremely exciting because household contacts are the most high-risk contact you can imagine. It was shown that with just a first dose, AstraZeneca persons who had received that vaccine, they saw a 50% reduction with just the first dose among household contacts. So that's also very, very good news. As I'm on the question of vaccines, a question that keeps coming up is why we put the 3 weeks and why not 2 weeks? We looked at the 2 weeks. 2 weeks is actually a minimum. And when we originally set that parameter, the guidance around AstraZeneca was around 2 to 3%, Moderna, Pfizer 2%. So we took a very conservative 3%. And that's a very safe bet. So you know that within 2 weeks, it should be have kicked in, but that's a minimum. So we have left it at 3 weeks. We're also thinking forward in terms of the future, in terms of the guests, the clients that will be coming in and so on. And you're going to have to approve them in terms of the vaccination. It made for a more streamlining of the process if we were able to say 3 weeks after your vaccine, we consider you immune. Whichever vaccine you were taking, that would cover all three, all the various vaccines.
And since there's a question alive right now, can I interpret what you said about the person who was tested out of quarantine yesterday, but seemed as though they recovered at the time of testing? You're saying that it's likely that they would have contracted and shared and recovered within the 2-week period, and that is why your test on the last day of quarantine would have shown them as recovered, right?
Yes, exactly.
Okay. Great. So hopefully that is answered. All right. So now I'll move to the Commissioner of Police for his update.
Okay. Good afternoon, everyone. It was another good day for the police, actually, for the Royal Anguilla Police Force. And I'd just like to thank the members of the public again for all the help in making sure there's compliance. And the compliance checks are working so well. We had 6 land patrols yesterday, and we had 3 vehicle checkpoints. We stopped 15 vehicles. There were 4 breaches yesterday. One was a gentleman walking, one was a gentleman travelling home after his girlfriend, and there were 2 other breaches as well. There were 3 sea patrols, no boats were sighted, so therefore none were intercepted. And the covert or the confidential email address from the day we started has now gone up to 24 notifications. And we had a call yesterday to the station about a boat as well. So we thank everybody for all the calls, and we'll take them all forward. The only other thing I'd just like to comment on, I think there was a video yesterday going around the island of somebody being particularly critical of the Royal Anguilla Police Force and making various suggestions to them. That gentleman's just helping us with our inquiries, and I understand that will be progressed during the day. So thank you very much for all your help, everybody, and thank you very much for being so compliant when we stopped and spoken to you, the few people we have spoken to. Thank you.
All right. Thank you for that brief presentation, and it's good to hear that things are going well on your end. We're now at the question and answer period of our press conference, and I'm seeing Radio Anguilla Felicia Hennis.
Good afternoon. My question is in relation to the press release that was issued yesterday. I'm just wondering, I take note that it says fully vaccinated persons. So at least from today, persons can congregate in a group up to 12 persons. And as we go into step 2, on the 14th of May, fully vaccinated persons can dine, at restaurants, gyms, and churches and so forth. So I'm just wondering if persons are allowed to dine in who are fully vaccinated, will the staff, will they also be required to be fully vaccinated as well?
I think the PS Health is responding, but I'm not sure.
I'm not hearing anything.
That would be the expectation, yes. The same would apply for the staff.
Okay, and just going further into my question as it relates to churches, again, persons who want to attend church, they have to be fully vaccinated. Will this also be required for pastors, leaders of churches? Will they have to show proof that they are vaccinated in order to hold services?
Yes, the same would apply.
Okay, all right. Thank you.
I'm seeing NBR.
Yes, good afternoon, everyone. And let me first commend the government of Anguilla for the regular updates. They are very beneficial and help to support, help to benefit the public. I have a question for the CMO, and you mentioned the variant. You described a variant that is a variant of concern. You described the variant of concern. But can you describe for us the variant of interest that we have? Can you expand on it more, what it is like, the variant of interest? Could you describe that for us?
To be clear, we're dealing with a variant of interest that was first discovered in the US. Right? So converse to the variants of concern, the variants of concern are of concern because they spread disease faster, people are more sick, they die, and you have questions on whether your vaccine will be effective. So with the variant of interest now, you're just seeing mutation, but you're not sure at this point in time, there's no evidence that is of any untoward implications. Remember, all these viruses will mutate and mutate and mutate. Not all the mutations will have consequences. With the variants of concern, you start to see consequences and you put them on the radar and you see bigger outbreaks, you see more people dying, you have questions of whether your vaccine will be effective and efficacious. So with the variant of interest, you're going to have lots of those, but they have not crossed that line thus far. So we're dealing with something that was discovered in the US among the myriad of variants out there, but it's a variant of interest. And more importantly, it's not one of the ones that has been highlighted like the one discovered in Brazil, UK, Japan, and so on and so forth. So we're not dealing with a variant of concern.
Thank you.
There is a question about whether vaccinated persons can give blood. CMO.
Certainly.
Yes, certainly. There's no prohibition of vaccinated persons giving blood. In fact, I've been vaccinated against so many things over the years, and I give blood as often as I can, as often as I need to. The only thing prohibited from giving blood is when I have a flu, I have some sickness, some infection that prohibits me from giving blood. But other than that, I mean, I have had vaccination when I'm a child. I mean, when I went to university as a 17, 18-year-old, once I got to the States, there's certain immunizations they didn't give in Angola. Before I could start university on day one, I had to go out and get my shots. So yeah, there's no, as long as you are healthy, as long as you can give blood, and as long as your doctor signs you off, you can give blood once you have the vaccination.
Brenda Carty, your hand is up.
Yes, good afternoon. The CMO said that only 50% of hospitality workers had been vaccinated. Now, we have been hearing that there was going to be legislation passed by the Attorney General. There's only a week to go before the May the 15th deadline. So my question is, has that legislation gone through? And what is the position for hospitality workers?
Premier.
Yes, thank you, Brenda. The Attorney General, the draft regulations are being done, and as soon as they come to Executive Council for review, and they will be passed. We do, as we've said, frontline workers, we are encouraging to get vaccinated, and it is going to be necessary if we do not meet our targets to make it mandatory for frontline workers, public and private, to be vaccinated.
Thank you. I have a follow-up question. Small businesses, it's difficult for them. Is it possible, can employers insist on their frontline workers. They all have frontline workers, be it secretaries, receptionists, or whatever. Is it possible for employers to also insist on vaccination for their people? And if they won't be vaccinated, is it legitimate for them to send them home? How does that work?
Well, we do have, I think we have the Minister of Labor on, but I can say that certainly, you know, it is, you know, there's no right to work. So if the employer decides that they want the employee who is going to be working that closely to the public, where the public has that first contact, that they want them to be vaccinated and they're eligible to be vaccinated, that is something that the employer can make that decision. They certainly can try to find a different job for them if that is doable. But if it's not, you see this in all the different islands and regions where it is happening, you know. And the reason, it's not that governments want to be overbearing and to dominate the people. It's that, you know, everyone knows that healthcare systems in the Caribbean, whichever island or country it is, that these can be overwhelmed very quickly. We also want to make sure that our people are safe and protected, and also tourism being our main industry, that we want to make sure that you know, when persons come in, and that we don't have to restrict their movements if our populations are adequately vaccinated. And that's we're looking at that number of 70%. We'd prefer 100%, but we're saying 70% is the minimum of persons vaccinated to give us that sense of herd immunity. Now we see what happened in the Seychelles. Seychelles got up to 60% and felt that, okay, well, let's give it a shot. And now they're in lockdown because of, you know, the virus came in, got away. And that's what could happen to us. We saw with this cluster that, you know, if it was not for the diligent and vigilant efforts of the health team, we could have had a similar situation where it would get out of hand. So we don't want, you know, we get to July 1st, we're opening up the country, and all of a sudden, you know, we have persons not vaccinated get infected, that spreads to our children and to our vulnerable populations, and then we'll be in real trouble. You know, I've heard this thing about trying to divide the country into those vaccinated versus those unvaccinated, and the vaccinated persons having certain you know, incentives and privileges that unvaccinated don't. I mean, if you understand, put yourself in our shoes, put yourself in the shoes of the health team that has been working, you know, day in and day out, and you know, 24/7 to try to get us to a state of protection and immunity. You know, let's do it for the country and for our community.
Thank you.
If I can just add, Parliamentary Secretary, before you proceed, I would invite anybody to go and look at what's happening in the Seychelles. The outbreak there right now is amongst persons who are not vaccinated. It's amongst persons who have not taken up the vaccine for whatever reason. But those other 60% of the persons who have been vaccinated, of course, you're going to have breakthrough vaccination, breakthrough infections periodically. But the bulk of the outbreak in the Seychelles is amongst young people and other people who have not been vaccinated. And the evidence just piles up every day. So when we get you know, statements like the vaccine doesn't work, we wonder where this evidence is coming from.
Right. There is a question about how do we intend to police vaccinated versus non-vaccinated, but similar to even in the bubble, all entities have a certain duty of care, whether it is to ask for the vaccination card before they do certain things, or take a record of who was there for the purpose of contact tracing. So can we just have a quick conversation about how we intend to police that, and what's the benefit of record keeping? CMO or PSL?
Yeah. I'll have the CMO come in after. It's certainly important that persons keep track of who's entering the premises. And certainly, just like when persons go to the bars or restaurants and so forth, and they need certain IDs to access certain services, you ask for those things to show certain services. And then we're going to be requiring that person have a log as well, so that we can keep a track of who is where and those type of things for our contact tracing and those type of things. Because initially, until we get up to that 70% mark, we have to still be in a state where we are looking at the possibility of persons transmitting left, right, and center. So we want to be sure that these businesses keep a track of who they're giving services to. And also we're looking at a way of ensuring that fully vaccinated persons can be identified very easily.
All right, thank you very much.
I just add that, I would just add to what the PS said. It's what we call one of the sort of I would say mitigating measures, so that if something were to happen, God forbid, we're able to track more easily, as he said. So it's just as we give concession and we try to give some freedom and ease up restrictions, that's the other side of it. We have to have people work with us. So in case something happens, we'll be able to track and contain very easily.
Question from the Anguillian and then Class FM.
Good afternoon. James Harrigan here from the Anguillian. On the variant of interest, the CMO, was all 65 patients, positive patients, tested and sent off as samples, or were just a few samples sent off?
Well, that's a very good question. The standard practice is that you have a maximum of 10 samples. In epidemiological terms, once you have identified an outbreak situation, you don't quote unquote waste resources sending for something like genomic sequencing for all 64. So we do have a limit, and you would note that of the 7 that were accepted that went through, all of them were the same variant. So it speaks to the cluster, and it's the same variant, right? Yeah, so that's the short answer to that. Unless we see something else brewing, there would not necessarily a need to further the sequencing. It's a resource constraint. UA is testing for the entire Caribbean, and it's standard practice. Once you establish there's an outbreak, you send the requisite number of samples. If we had seen a strange pattern, like there were different variants or something, then we would have to look a bit more. But for the moment, we're restricted to 10. 7 got through because the CT values gave enough virus, and they were consistent, same strain, same variant.
Another question I have for someone in connection with vaccinations. Come the 28th of May, when the restrictions are quote-unquote fully lifted, would everyone who turns out to work need to show evidence or card for being vaccinated?
Yeah, those persons who will be required to work in areas where they require vaccination will have to show some sort of identification or some sort of evidence that they've been vaccinated. In some cases, we only requested the first dose. In some cases, we requested fully vaccinated. So yes, those persons were required to work in areas once the regulations go in place. Once the regulations go in place that require persons in certain sectors to have vaccination, then you'll be required to show evidence of vaccination.
You say certain sectors, I reckon you mean those who are frontline or in the back?
Yes.
Class FM?
Yes, good afternoon to you. A question for the medical team about the testing of those persons who are now in quarantine. Before discharge, will each of those persons be retested?
That is currently on the way. That's what we said. We've so far prioritized 245 of the quarantine persons, and we're continuing with. Oh, by the way, we expect that that's going to wind up around Tuesday. Remember, we quarantined a lot of persons. A lot of persons were tested, so we're conducting follow-up testing as we speak.
And it's critical for us to do that because as we often explain, contacts may not necessarily show a positive on the first day of contact. In fact, you can't because the viral load is just too low. But you still have those people isolated, or you have them quarantined, and then you test them again at the end. Some of them will be negative, Some may be positive, and you have to keep them on a little longer, but you have to test them before you let them out. That's just the way it is.
Okay, and a follow-up question for perhaps the Minister of Health. We note that in the UK, the AstraZeneca vaccine, people over 40, under 40, are not given that vaccine. Perhaps Minister of Health, do you think the UK is willing to consider providing an alternative vaccine for that age group here in Anguilla under 40? And this is coming against the backdrop of our hesitancy we're hearing from some persons here in Anguilla.
That's a good question, Hammer. You know, we have AstraZeneca. We've been promised enough doses to cover the population in Anguilla. The side effect profile is very rare. It's about 4 in a million chance of you getting blood clots. And so the chance of that happening in Anguilla with a 15,000 person population is minuscule. Certainly there are small side effects like, you know, injection site soreness, fever, chills, which resolve within the first 1 to 2 days. But the chance of getting anything that significant is very rare. And so there's, you know, we are continuing with the AstraZeneca vaccine, and we consider that the safety profile of it is a lower risk than, and I mean, the benefit is higher than the risk. Now, I have asked, of course, about the Pfizer or Moderna vaccine for Anguilla for those under 30, given that that was one of the things in the UK where they have that option. At this point in time, the cold chain that would be needed to get Pfizer from the UK to Anguilla and the vaccine survive that, it would be very low given that we don't have direct flights from the UK, and similar with other vaccines. And so that at this point in time, what we have, we consider that it's safe to give. Otherwise, we wouldn't be recommending it. And the regulatory agencies have looked at this very carefully and have suggested, including Public Health England, that we, you know, persist. And also, if you look at the timing that we have, these vaccines have expiration dates, and we need to get them into arms so that people can be protected. I don't know if the CMO have anything else to ask, but I did ask about it, and I think given where we are, you know, the chance of us getting another vaccine is very, very small. And certainly, as I said, the cold chain, you know, requiring -70 degrees to keep it safe to get it here and then to distribute it, I think that the risk of losing a lot of those doses is very high.
Just to add to what the Premier said, which is spot on, I mean, we have these technical discussions literally every week. This came up again today, Friday, with the latest guidance and whatnot. And PHE, to be clear, is supporting this. We have discussed the possibilities. It's not going to be feasible for us. There are very strict protocols around the cold chain management. That's why our countries were taken out of the equation in terms of Pfizer and Moderna early on. That's not going to change. You recall even when we had the AstraZeneca here, we had to get permission. Things had to be in a row for them to say, okay, you can go ahead and start giving. So it's very, very tight protocols around these things. PHE is saying full swing, speed ahead. It's almost a luxury issue over there because they do have several candidates, and by the end of the year, they might have 6 or 7 more. And the regulatory agency in the UK has not put any kind of age contraindications around that. Another very important thing to realize is that this extremely rare the outcome is only associated with a first dose. And even the vaccine committee that's saying, okay, if you have something else, offer something else, which is what they're saying, to avoid even this minuscule possibility, because they have so many actors. They're saying if you didn't get the reaction the first time around, regardless of your age, just go with it, just continue with it. So you have to understand the layers. So just bear that in mind.
I think one of the challenges as well is the fact of the local capacity to administer the vaccine. In addition to the cold chain that the Premier spoke about, those vaccines in terms of Moderna and Pfizer have to be held at -70 degrees in terms of the Pfizer, -20 degrees plus in terms of the Moderna. These are capacities we'll have to develop locally to be able to hold them at long periods of time. But under that, the actual administration is a whole different ballgame as well. I can recall when we did a training back in December with our team in PAHO, the challenges were really brought to mind as to how to administer these as well. So we certainly feel comfortable in administering AstraZeneca. We've done it now to almost 8,000 persons first dose, almost 3,000 persons second dose, with my side effects and these type of things. In fact, I keep telling people the possible risks associated with AstraZeneca is so small. When you do certain stuff, the actual risk of getting these type of side effects or these type of impacts of the thrombosis and blood clots is much greater. A simple flight of 4 hours on a plane, the risk of getting this type of blood clot is greater than taking AstraZeneca. If you take a contraceptive, it is much greater. If you smoke cigarettes, it is much greater. If you get COVID-19 disease itself, almost 40% of the persons who get COVID-19 disease have these type of blood clots. So I think when you look at the risk, when you look at the ability to have a safe vaccine compared to the risks of not having the vaccine or the risks of getting the virus, the disease itself, then the benefits of taking the vaccine certainly outweigh the risks and outweighs the negative consequences.
Thank you for that. I'm just going to ask the members of the media if you already asked your question and your hand is up from your old question, please see to it that it's down. Otherwise, I will think that you're asking a question and come to you. So just please click your hand down if your question's already been answered. I'll now go to Dawn of the Daily Herald.
Thank you. Good afternoon, all. To the health team, thank you very much for clarifying the 2 versus 3 week issue with the timing after the second jab. That's something that was asked frequently, and now everybody understands. I'd like to ask 2 questions. The teachers, when the regulation is written for frontline workers, this may have already been said. If it was, I missed it. Are the teachers going to be included in frontline workers? Will they be classified as a frontline worker in terms of being having to take the vaccine? Hello?
Yes, certainly in terms of persons who not only work in the tourism industry as a hospitality industry, which are definitely persons of interest, but certainly persons who actually work with large groups of persons who are vulnerable groups will be considered frontline as well. In addition to teachers, it certainly be persons in the health sector, certain persons in the public sector, and so forth, because these persons will have direct access to large groups of persons who themselves can either to themselves are vulnerable groups.
Okay, great. And one more very quick question. The card that we're given that verifies that we have taken our second shot, they're kind of bulky, and carrying them around to prove that you're legit to be in certain places. I know you mentioned that we're going to get driver's license type cards here soon. Do you just kind of have a estimate as to when to expect that?
Yes, we actually have procured the equipment, and we should have most of that stuff on island another week or thereabout. We begin to do some testing. We're now working with the Department of Information Technology. So we are hoping, I don't have time into this, but we're hoping that by the end of this month, we should be able to have those things in place early next month.
Great, thank you.
Felicia from Radio Angola.
Thank you. Good afternoon again. According to the press release, our borders reopen on May 21st for returning residents. What are the protocols, procedures that are in place for returning residents?
The same protocols.
Okay, so those who are vaccinated, perhaps, will they have to quarantine for 7 days, or will it be the same 14 days?
Yes.
No, remember we had made that transition already before the closing for the cluster.
Right.
All right, good. I have a question also for either the Minister of Tourism or the Parliamentary Secretary. Our borders also, we are open and we are receiving guests on May 25th. Can you give us an update on tourism? I know we were marketing the island as COVID-free and as a safe destination. Is the interest still there despite our current situation?
The interest is definitely still there. It was very clear that Angola moved swiftly to respond to COVID-19, even though the persons who were on island appreciated what the protocols were. Some would have left early and others decided to continue their stay because they would have still had access to their properties and movement on their properties. So the interest is there. We've had an uptick in interest for Memorial Day weekend. And as a result, the portal will be opening in mid-May. I don't want to give a definite date as yet, but it will be shared by the ATB through the ATB's page. But the portal will reopen in mid-May for to accept. Sorry, someone to accept any bookings from the 25th of May onward. And the portal also will accept bookings for Angolans returning on the 21st of May. So things are looking good and we are very excited about our place in the market. Very few countries in the world consider they had no outbreak, but people respond to countries that prioritize safety. And it was very clear that Angola did prioritize safety, keeping the people of Angola safe and protect and existing tourists and potential tourists safe by the way we've handled this cluster outbreak. So the interest is still there, and when we reopen, it will be like continuing the fall.
I think Parliamentary Secretary, it's not necessarily the cases that we've had, but in terms of how we've cleared those cases and how we've managed those cases. At some point in time, once it's managed properly, we'll get back down to no local cases and no cases in the cluster. And then it will be only imported cases as we've been experiencing for the last year. So that is a critical part. So once we get back to that level, then we can be as we were before. Once the virus is no longer circulating in Angola, we can be as we were before.
One question from, Brenda Carty.
Yes, just two very quick questions that came online. One, are shop cashiers and store cashiers considered frontline workers? And the second quick question, if you're walking on the beach and you're with somebody else and you social distance, do you still need a mask?
Yeah, and in terms of cashiers and so forth, those definitely will be considered frontline workers. I mean, how do you separate a cashier who has the possibility of meeting 500-600 persons a day at the front store from someone who's working in the tourism industry who's going to be seeing tourists in the same vein? So yes, frontline workers certainly will have a definition that covers more than persons working in the hospitality sector.
Thank you. And the masks on the beach?
Especially now that you're fully vaccinated. I mean, that's what the world is moving towards. That's one of the benefits of being fully vaccinated.
Thank you, CMO. I do want to say that there is still a mask mandate until at least the end of June, where persons will be required to wear masks in places where they cannot social distance. So if you're, out in your yard by yourself, you don't necessarily need a mask. But when you're going into a building or into an office space, church, and other areas like that, you will still be expected to wear your mask. For clarifications, I'll now turn to the Premier for closing remarks.
I don't know if the commissioner is on and would prefer to go ahead of me, if that's okay, Paul Sack.
Okay. Commissioner of Police.
That's very kind of the Premier. I haven't got anything else,
Hello, I had a question.
anything extra to add, really. So thank you very much, Premier, for the offer.
I had a question.
Sorry, NBR.
Okay, after the press release yesterday, there arose some concern as to when the general populace will be allowed to regather for worship. And would there be any restrictions for gathering where the general populace are allowed to regather for worship? When that will be, and would there be any restrictions?
Yeah, we are looking to remove all restrictions by sometime in June. I think it's like the first or second week in June we lift those restrictions. But certainly for now, and it all depends on the situation on the ground, as we always indicate. But certainly for now, we'll have to keep those protocols in place.
All right. Hopefully that answers that question.
Sorry.
I also had a question.
My mic was muted. My mic was muted. Judging from the press conference, it looks like June 1st. What we say?
Yeah. I think that's the date we are shooting for.
Oh, okay. Thank you.
I have a question also, Premier. Can I be indulged?
Yeah.
With regard to Welch's Fest with Monday, will there be a Welch's Fest?
Premier, did you hear that question?
I realize you talked about Angular Day, right? Certain protocols for Angular Day coming up, but would there be a Welch's Fest on Monday?
I think that understanding the restrictions, that there'll be no gatherings of more than 12 persons, and so I don't think that that would be allowed. It's not that we're trying to restrict persons. We want to make sure that we protect the country, and you usually need at least 2 incubation cycles after a cluster of positive cases to make sure that we're back to where we don't have any cases that may have come under the radar. So I don't think that would be a consideration at this time.
Before you make your, go ahead.
Yes. In addition to what the Premier has just indicated, I would want to take us back to a bit to what the Chief Medical Officer said a while ago. We have to test people before they can leave quarantine. So it is possible that we will pick up more positive cases. So I don't want us to feel and rest on our laurels that this is all over with. We've had persons in isolation. We've had persons in quarantine. We are going on the assumption that these persons have been behaving themselves, that these persons have been taking care not to leave their homes. And we've had certain situations where certain persons have left their home and the police have had to take charge of these persons. So we are now testing people out. And the CMO has indicated that this won't be done until next Tuesday. And we can, based on what we know about the science of testing, I can guarantee you there'll be more positive between now and next Tuesday. So what we would have to be sure about is that when we pick up these positives, have these people stayed in isolation? Have they not broken quarantine? And did they keep this positive inside the home? Because it's possible that if our husband was positive, our wife, and they did not isolate properly, they could have transferred it to our son, our daughter, our husband. So we're hoping that over the next few days, we can get a better sense of, has this happened? And this will give us a better idea of going forward. So I don't want us to feel as if we are 100% of the woods as yet. We are to a point where we have released and have allowed certain other essential services to function. But we have not yet recommended to Executive Council that we allow people to be outside beyond 6 and beyond 6 p.m. and before 6 a.m. in the morning. And that's why we've done that, because we're still doing these testing. We're still trying to ensure that we've cleared the virus, and we're simply not there yet. And the Premier spoke to at least 2 incubation cycles after the last case. That would take us down to about the 29th of May. Certainly, because the last case was would have been last Thursday, about that we would have taken that from. But certainly, we will not feel 100% secure that we've cleared the virus until at least 2 incubation cycles after the last positive, and we're simply not there yet.
Thank you, PS. Would you like to make any closing remarks before I move to the Premier to close us out?
Well, no, I'd just simply like to thank those persons in the public who has given us support, and all of those persons who have called and sent messages and given their support to the staff at the Ministry of Health and the government of Angola. We want to thank you so much. And even those of us who sent the memes of me smoking the cigarette, I want to thank you as well. It was a little time of levity. It was a little time of levity. It made me smile. It made me laugh. And you need that as well. And we want to thank persons for that little moment of levity that made me smile. But rest assured, we're trying our best to make sure that Angola remains safe. Thank you.
This is a plea. Please stop stressing faster. Now we will move to the Premier for his closing remarks.
Yeah, thank you very much. You know, it's good that we can have some levity in this because of the seriousness of it. You know, they say laughter is the best medicine, and I think that's what's kept us sane this far, given what we know. You know, it's you know, just going on from the theme that yesterday was the National Day of Prayer. I feel like a pastor who's up on the rostrum, just making that altar call, and some people come forward, but you know that there's someone sitting there in the pew who's uneasy. You can just see them squirming, and you know that they need to do something, but they're holding back, in whatever spirit that is that's holding them back. You know, that's why I'm just begging and pleading that persons will you know, step up to the plate, you know, register, get vaccinated, because you're doing it for yourself. You're doing it for those who can't be vaccinated, and the children, and the pregnant women, the those who would have a medical condition that they would have a adverse reaction to the vaccine. And there are very few of those, but they exist. And so I'm asking all you know, persons 18 years and older to get vaccinated, so that we can protect yourself, protect your family, and protect the community. But also, as the Permanent Secretary for Health said, that when the time comes that these vaccines are cleared and that they can be given to children, and then also we want to you know, impress upon parents to get their children vaccinated, because that's the way we can move on from this, just like the world has moved on from other illnesses that caused severe morbidity and death. So I thank you. Thanks for listening to us, for tuning in, those here in Anguilla and elsewhere. And you know, if there are any questions or concerns, certainly you can call the COVID hotline, and or check the Facebook page or the website www.beatcovid19.ai. Again, thank you very much. Have a safe, healthy, and pleasant weekend. May God bless you, and may God continue to bless Anguilla.
An item for persons asking about the protocols. It has been published on the Government of Anguilla's page, and if you have any questions about it, you can ask the questions under the published protocols, and we will answer you there underneath the questions in the comments. Thank you again for tuning in.